7 surgeries, countless patients, and sleepless night shift, and one accident so horrific that I still remember it today. This semester, my life completely changed. As a second-year medical student, I entered into the hospital for my surgery and internal medicine post. I wasn't allowed to operate yet, but what I witnessed inside these hospitals taught me lessons that classroom never could. And later in this video, 2 Australian doctors answers 3 questions that every medical student wants to know. Is Australia really worth it? How can an international graduate work there? And how much do doctors actually earn there? Welcome to Phan Chau Hospital. This is where my surgery rotation will be. Let me give a quick tour of the hospital before we enter my department. As a second-year medical student, our role is mainly observational. We are not allowed to perform surgeries yet, but we can watch every step carefully, ask questions, and learn from the experienced surgeons. During this posting, I observed 7 different surgeries. Every surgery was unique and every surgeon had a different ways of thinking. The best part, our clinical instructors were incredibly supportive. Every day they taught us something new, explained difficult concepts, and encouraged us to think like
everyone is very sweet-hearted and everyone tries their best to teach me. So it's wonderful.
I try my best.
Yes, sir.
To pass now teaching.
Yes, sir.
Because I understand that you have come from very far from here, and thousands of kilometers from
Yes, sir.
here, and from the different countries,
Yes, sir.
different culture, different foods, different religion, everything. But you have made so many efforts.
Yes, sir.
And to stay here, and so I really appreciate it.
Thank you so much,
I
sir.
hope that the day you stay here, everything will be successful, and I hope you enjoy.
Thank you so much, sir. Thank you so much. Have a nice day.
medical records. But observing patient isn't enough. Every patient we meet becomes a medical record that we have to write ourselves. History taking, examination, diagnosis, management, and later we have to stand in front of our instructors and explain everything in detail. It sounds good, right? But while I was in surgery department, I met 2 amazing Australian friends. This is Tim and Cindy. Before continuing the hospital journey, I asked them something many of us are curious about.
Is Australia a good place for doctors? Look, I'd say yeah, we've got really good training, doctors are paid pretty well, and we've got some really good laws to make sure that doctors aren't working too hard. So overall, I would say it's good.
Night. Hospital life doesn't end when the sun goes down. That's when the emergency department becomes even busier. I saw accident cases, trauma patients, emergency procedures, and people fighting for loss. So hospital life isn't only about study. Sometimes after long shifts, you meet some amazing people. Tim and Cindy weren't just knowledgeable medical students. They became really very good friends. Talking with them taught me about a lot about medicine and life. So naturally, I had another question.
How can they become doctor in Australia? Do they need exams? Can they directly join residency?
So usually you have to study medical science for about 5 to 6 years, maybe for about 4 years if you're doing it postgraduate. After that, you do internship for about 2 years, and then if you can choose to go to a specialty program, and that takes about 3 to 7 years. So all up, can take about 10 to 15 years before you're considered a full qualified specialist.
10 years.
Yeah, 10, 15. Really long journey.
I'll be old.
I'll be old too, don't you worry.
Okay?
Alright, now, dear Lord, if you excuse me, It's bidet time.
Okay.
After surgery, it was time for my next rotation, internal medicine. The hospital was almost 15 kilometers away from my house, but the journey was absolutely worth it. Let me show you the hospital. Then my first week was in endoscopy unit. Yes, this is where the doctors examine the digestive tract using cameras. Sometimes through your mouth and sometimes, well, through the other entrance. So yeah, medicine is definitely not glamorous as all the time. So what we actually do, our daily routine is simple. Meet patients, write medical records, present cases, attend wardrobes, do night shift, write on-call duty reports, and finally face the viva examination. So reality of medical story. One thing that I learned very quickly that doctors genuinely want us to teach, but the hospital are busy places, so patients always comes first. That means we also have a responsibility to study on our own. Nobody is going to spoon feed us forever. That you should understand. So how I study? How do I actually study?
So basically, about the way I study, it really works out. There was this patient, and they were talking about the H. pylori and the adenocarcinoma in the lower 1/3 of the esophagus and the upper sarcoma. All this stuff, I read it during when I was going through the common diseases from the anatomy to the physiology and every stuff. So the way I approach the stuff is really useful when it comes to applying it in a clinical way. So I would suggest you guys to, if you are doing the internship, I think this way of learning would really help it out.
And then comes the night shift. No comfortable bed. Sometimes we sleep on chairs, sometimes we sleep on floor, and sometimes we don't sleep at all. When hunger strikes, we go outside, grab some food, visit nearby mart, talk with friends for a few minutes,
Okay,
and then
one.
back to
Why is it the greatest drink, or why is it
I'll show you this egg.
okay?
This egg is one of the not greatest sports drink in the world.
Okay,
The reason is it has all the electrolytes just like any sport drink.
okay.
It tastes
Mhm.
and the sugar content
Mm-hmm.
it's not sugary.
Mhm.
It's very nice.
I also asked one of my classmates how was the internship been for him. Let's hear what he thinks.
Hi guys, we are with Shan. You guys have watched me, watch the YouTube. In every comment section, he'll be there. So yeah, Shan, how is your hospital training?
My hospital training is like a mixture of boring as well as some interesting cases, and that's all overall.
Which department are you in?
I'm in the internal medicine.
It's pretty good. You guys.
And before ending today's video, I had one last question for Tim and Cindy. The question everyone waits for. How much do actually doctors earn in Australia? And how much tax is deducted?
Junior doctors, while being paid the least, do get paid pretty well in Australia. So they get, on average about 80 to 100,000 Australian per year. Then once you enter a specialty program and you're training as a registrar, then your wage can sit between 150 to 250,000 Australian. As soon as you specialize, then it can range from between 250,000 to 400,000. In terms of how you're getting taxed, so again at the lower bracket, you might be taxed about 25%, and then when you reach the specialty wages about that 400,000, you could be taxed up to 40% of your wages. But there are ways you can claim back some of that tax through your insurance, all the conferences you go to, and all the equipment you get as well.
So that's been my journey through surgery and internal medicine. Every patient, every doctor, every sleepless night, and every mistake taught me something new. And this is only the beginning of becoming a doctor. If you enjoyed Inside the Hospital training with me, leave a like, share, and subscribe. What about the next video? The next video? Yeah? A day of pure happiness. Yeah, stay tuned.